Hello everyone, welcome to HealthQ channel. Myself Physiopraniti Bhilpawar. Today I am going to talk about 5 tips to manage cervical radiculopathy. Tip number 1. Understanding the condition. Patients should understand what cervical radiculopathy is and what all symptoms they are getting. They should monitor the symptoms so that the activities which are increasing the symptoms and activities which are giving relief to them. Tip number 2. Adequate rest. Adequate rest is very important for healing of the tissues and for the relaxing of the muscles. Tip number 3. Postural modifications. Patients should monitor the posture in which they are sitting, sleeping, walking and the working posture so that the neck muscle should be at a minimum stress when they are working. Tip number 4. Activity modifications. Whenever patient is working, they should monitor the activities which they are giving rise to pain. So, those activities should be limited for some amount of time. Give some time to heal the tissues to relieve the muscle spasm which has occurred because of the prolonged stress on the neck. So, that activity modification is very important. Tip number 5. Thermal treatments. In thermal treatment, we can take hot fermentation or cold fermentation. If patient is suffering from acute pain, that is if pain is below 48 hours, less than 48 hours, then we should take cold fermentation. So for cold fermentation, we can use an ice pack or ice cube or some vessel which is filled with the ice, and we need to apply it for 5 to 7 minutes, 2 to 3 times a day. Then comes hot fermentation. If the pain is chronic, patient should take hot fermentation. For that, we can use an electric hot bag or a water-filled hot bag. After following all the 5 tips, if patient is still having symptoms, please visit your orthopedician, take medicines, take the condition treated, and you can also visit a physiotherapist so that you can learn proper exercises to relieve the pain.